Hello, I'm Dr. Asavari Manvikar. I would like to welcome you all to CAR, Council for Ayurveda Research, Global Webinar Research Series. Council for Ayurveda Research is an international non-profit organization based out of USA and with its sister chapter in India by the name Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to educate, encourage, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. And no nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer, and we can place you in a variety of projects based on your skills and your interest. Once again, our website is ayurvedaresearchusa.org. Now, let me introduce our platinum sponsor, Komal Herbals. It's a company based in Pennsylvania. It is focused on the concepts of Ayurveda and the power of being healthy using herbals and natural products. Komal Herbals work hard to find premium ingredients for their herbal formulas. They also source herbs and spices that are sustainably and organically grown around the world. Now let me introduce our eminent speaker today. Namaste. Dr. Gouri Borkar. She is MS in Strirog Prasuti Tantra. She is BAMS and MA in Sanskrit. She has achieved many academic awards. She received grant from CSIR for thesis titled On Effect of Shatahvadi Basti in Garbhasanga during her post-graduation. She received the heritage knowledge of Ayurveda from Ayurved Vidya Parangat Vaidya Samir Jamadagni sir as per Guru Shishya Parampara. She achieved third rank in Stri Rog Prasuti Tantra in third BMS, second rank in Roganidan and Vikruti Vidnyan in second year BMS. She has distinction in Sanskrit in first year BMS. She is winner of prize in International Seminar on Heart in 1999. She is also a recipient of National Merit Scholarship Award in 1990 in Standard 10th. She has done many scholarly research work. Few of them I'm going to talk about. She completed her research work with Baidyanath Ayurved Bhavan on topic of effect of Sarvatobhadravati in CRF in 2019 to 2020. She is involved in Sashakta Bharat Abhiyan conducted by Vishwavati Ayurvediya Chikitsalaya and Panchakarma Center for purpose of increasing immunity, and has also given her inputs regarding research of causes and effects of pandemic on human body. She has pure Ayurvedic practice in Dombivli, Thane. She also practices in Kothurud. Since almost 2000, she started doing her practice. She has published many books. Tridoshantak Vida is one of the books that gives insights about the medicinal properties of Vida and its contents. Jalagatha, e-book that is published on Kindle. It is a book dedicated to properties of water, various Ayurvedic Siddha Jala, and its impact on body. She has published a book on infertility, a 360-degree thought process on infertility. Bija Yog, Ayurvedic Garbhasanskar, the book highlights about diet and care to be taken right from conception to postpartum care. She has participated in various health talks, interviews on TV channels like Z24, TAS, Z Marathi, 18 Lokamat, and Sam TV. She is involved into many health talks that benefits to community and Ayurveda graduates, students, Arogya Charcha, Samhita Vachan of Ashtanga Hriday. She has achieved many awards. So she received Dhanvantari Award from Baidyanath Ayurved Bhavan in 2019, Thane Ratna Award in 2020, Ayurved Icon by Sushrut Award from Dr. Piles Clinic in 2021, Sri Vaidya Ayushri Award in Ayush Darpan in 2021, Ayurved Ratna Puraskar in 2023. She is also very responsible socially. She has been providing guidance and practical training to young students over last decade. More than 500 students, Ayurvedic doctors, have undergone rigorous learning and started their own practice. She arranged nature trails to educate about the medicinal plants and heritage Ayurved knowledge. She organizes various competitions for students. She is honorary consultant at Vishwavati Ayurved Clinic at Kolhapur. She has published many articles. She contributes an article every month for a magazine, Vishwa Pandhari. She creates awareness about Ayurvedic herbs through publishing articles under the heading of Herb of the Month on website Shri Rukma Ayurved each month. She has published various articles in newspapers. If you want to reach out to her and learn more about her, please go to her website www.shrirukmaayurved.com. She also has her own YouTube channel. So you can also watch her YouTube channel to learn more about her. Namaste, Dr. Gouri.
Yeah, namaste. Thank you. Thank you so much for the kind words for me. And can we start now?
Yes, absolutely.
Okay. Yeah, thanks. Firstly, I thank Dr. Asavari Manvikar to give me the opportunity to present my work over here. And also, I thank the Global Council of Ayurveda Research, which is established in, I think, 2014, right? So, to give me this opportunity over here to present my work on Shatahvadi Basti in Garbhasanga. Many of the times it happens that when a lady enters for labor, enters in labor pain for a delivery, the typical the pitocin drip, and if not responded that pitocin drip is not useful for that patient, then the patient is taken for the lower section, lower segment cesarean section. So how to avoid the increasing rate of this cesarean section? So in that process, this project is aimed at to study the Sukha Prasav, that is normal vaginal delivery, and to study the new line of non-surgical treatment for the prolonged labor. So the objectives are to find the hetu of Garbhasanga, to find the roop of Garbhasanga, Sadhya Sadhyatva of Garbhasanga, and to also to promote the vaginal delivery, Sukha Prasav, and to take care of the health of both mother and the baby, and thus to avoid the post-operative complications. Okay, so in text, the word Garbhasanga or the diagnosis Garbhasanga is not clearly mentioned in our Samhitas. So literary review says that the Garbhasya Sangaha Garbhasangaha, that is Shashti Tatpurush, and Viloma Apana Vayuna Garbho Yadi na Nisaret Sa Garbhasangaha Ityukta. This is the definition we found in Ayurvediya Shabdakosh. So this means that Viloma Apana Vayu is the main hetu of the Garbhasanga, that is vitiated Apana Dosh, Apana Vayu, and Garbha Yadi na Nisarit. This means that there is no descent of the fetal head, and these two conditions is called as Garbhasanga. So for study the Garbhasanga in literary text of our Granthatre, we extract the word Sangha from Charak Samhita, Sushruta Samhita and Ashtanga Hridaya Samhita. We found the related elements for this Sangha are Shotha, Gulma, Rajakshma, Arsha, Udar, Atisar, Chardi and Mutraghat. All these elements were related to Sangha in the Granthatrayi. So Samprapti of Garbhasanga was established with these factors. The Vata Prakopak Ahar Vihar, Ruksha Shita Khara Gunavriddhi, Vata Prakopa. Same time, the Garbhini is having Kapha Vriddhi in her body. So Divasvapa Guru Bhojana Kapha Vriddhi Kar Ahar. This leads to Sroto Rodha in the body. So Sroto Rodha lead to Kledadekya Dhatu Shaithilya and Garbhashay Shaithilya. Here the Vata Prakop, we can say that the Vimarga Gaman of Vata Dosha, the Pratilomatva of Vata Dosha, that is Mudhatva of Vata Dosha, because of the vitiated Gati of the Vata, Apana Doshti and Pranavaha Sroto Doshti is there. This leads to obstruction of expulsion of Vata, Mutra, Purisha and Garbha. Same time, in Pranavaha Srotodoshti, the Hridaya is the Mula Sthan of the Pranavaha Srotas and Avasthi Sthan of Vyana Dhatu. So Vyana Vayu also get vitiated, and because of this, the Anirasya Mana Garbhatva. Here we can say that there is obstruction of expulsion of Vata, Mutra, Purisha and Garbha, and here because of the Dhatu Shaithilya, Garbhashay Shaithilya is there. Because of the Garbhashay Shaithilya, Manda Avi, that is the amplitude and contraction amplitude is lower side, and because of that the Garbha is not getting descended properly, and because of this the Anirasya Manatva of Garbha, and that leads to Garbhasanga. This was the Samprapti established with the help of the Granthatrayi references. Materials and methods. 30 patients Prasavotsuka are selected in each control and trial group. The exclusion criteria was the patients with general major illness, placenta previa and Mudha Garbha, that is the obstruction, that is the malposition of the patient. Material methods, the Shatahvadi Basti, the reference in Ashtanga Hridaya Sharir अध्याय 1 शतावा सर्षपा जाजी शीघ्र तीक्ष्णक चित्रकैः सहिंगुकुष्ठ मदनैः मूत्रे क्षीरे च सार्षपम तैलम सिद्धम हितम पायौ. This is the reference of the medication or the medicated oil we have used in our study. The material methods we can say Shatava, that is Anethum sova, Sarshapa brassica compestis, Ajaji, Cuminum cyminum, Shigru, Moringa oleifera, Tikshnaka, that is Piper nigrum, we can call it as Marich also, Chitraka, Plumbago xylanica, Hingu, Furula narthex, Kushta, Sasuria lapa, and Madanfallis randia spinosa. These were the medications, these were the drugs which were used to fortify the mustard oil. This oil is prepared in the mustard oil. The material methods, the Shatava, the Rasa Virya Vipak. Overall, we can see that the Rasa of the major content is the Tikta Katu Rasa, Vipak is Katu, and Virya is Ushna in all these drugs. So Ushna Virya is responsible for Shamana of Vata dosha, and also Katu Vipak will be responsible to get rid of the Dhatu Shaithilya and Kleda in our Sharir. These are the active principles we found in from the Nadakarni Pharmacopoeia. Also, the oil was prepared in Gomutra, Godugdha, and that was fortified in the Sarshapatel. That is, Sarshapatel is used as base for the oil, Godugdha and Gomutra are the Dravadravya, and this oil was prepared as per the Sneha Siddhi Paka Kalpana, that is 1:4:16. Okay. After that, this is the Shatahvadi tail prepared, and we give 240 cc of this Shatahvadi tail when the Garbha Anirasmana, that is Garbhasanga diagnosis was done. The plan of work: the Prosovetsika patient reached to hospital, is examined, and a special case paper was designed to examine the patient. The age, religion, desh, kal, prakriti, all the things were noted. Sroto parikshan, parity, gestational age, these things were noted, and history of menstruation, obstetric history, personal history, hereditary history, all these were noted in the case paper. The sthanic parikshan was done per abdomen, the height of uterus, girth of uterus, then the presentation of the fetus, which part is presenting, that is the vertex presentation or not, descent of the presenting part, contractions, all these things were noted, and per vaginal examination was also conducted. The assessment of cervix, the dilatation of cervix, the formation of forewater bag, presentation, clinical assessment of pelvis, all these things were done first. The pantograph of each patient is drawn and shave and prepare, and the parikshan was repeated after every 3 hours. This is a pantograph that was plotted for every patient. This was a pantograph which was plotted for every patient. This pantograph itself explains the process of the one sec. I want to enlarge this thing. Okay. So the pantograph is plotted. The pantograph presents the cervical dilatation. Also, yes, huh. This is a latent phase of the patient, and this is the active phase of the patient. First 8 hours, the patients show the 3 centimeter dilatation of cervix, and after that, every 1 centimeter dilatation of cervix 1 hourly, right? So this is the normal graph. The patient when enters, she was examined, and if there is 3 centimeter dilatation, that was plotted. If there is 2 centimeter dilatation, that was plotted, and the progress every hourly was noted on this graph. Even contractions per 10 minutes is noted on this graph. And when the patient crosses this alert line, then that was considered to be the condition of Garbhasanga, and at that moment of time, the Basti was given. This was the method used to diagnose Garbhasanga in the patient. The plan of work: the Viguna Apana Vayu, Adhan, Malasanga, and Mutrasanga. Due to Pratiloma Gati of Apana Vayu, contractions are mild, lasting for less duration. Then dilatation of cervix is not satisfactory, just as I have shown on the pantograph. The descent of the presenting part is not satisfactory. Then the pantograph crosses the alert line. This condition was diagnosed as Garbhasanga, and at that moment of time, the Shatahvadi Basti 240 cc Anuvasan Matra that was given to the patient. So these are the observations overall. The parity profile: the patients having primary, that is conceived for the first time, was out of 30, 23 patients were primary, and in experimental group, the 22 patients were primary. Generally, this study was conducted at a hospital which is charitable, and so the lower socio-economic patients were there, and so this was the parity profile. The hetu observed were mainly the Vatakar Ahar and Vihar, Ruksha, Tikshna, Anna, Atita Kala Bhojan, Anagata Kala Bhojan. These were the hetus found in the patients, and mainly second was the Purishavaha Srotodushti. That was one of the main hetu found in these conditions. Then the Srotodushti profile. This is the Purishavaha Srotodushti, Rasavaha Srotodushti, and mainly Pranavaha Srotodushti. Out of 60 patients, 40 patients were having Purishavahasrotodushti. Out of 60, 33 patients were having Rasavahasrotodushti. And out of 60, the 30 patients were having Pranavahasrotodushti. These are the main srotas which were involved in this condition. So pantograph status, out of 30 patients, number of patients crossed the alert line but not the action line in control group were 14, and the patients crossing the action line were 12. The experimental group, 19 patients crossed the alert line, but only 8 patients crossed the action line. Here we can say that when the Basti was given, the action line crossing, and the patients, number of patients crossing the action line was dramatically reduced. And when the Basti was not given, the 12 patients out of 14 patients crossed the action line of the pantograph. The pantograph, the patients crossing the alert line are 12, whereas in experimental group that was 19. And out of 12 patients, 2 patients were posted for LSCS, and total 19 patients out of 19 patients were having vaginal normal delivery. So this impact, states the impact of the Basti on the progress of the labor. In the pantograph patients, the route of delivery of patients crossing the action line, then the second action line is out of 6 patients, in control group, the 6 patients crossed the action line, and all the 6 patients were posted for lower segment cesarean section. And in experimental group, the 6 patients crossed the action line, only 2 were posted for the cesarean section. This we can say that all the 6 patients crossing the action line were posted for this thing, section delivery, and only 2 patients were posted for section delivery, and 4 delivered by vagina, that is a normal delivery. So this is the status of the route of delivery of all 30 patients. Totally 30 patients in the control group. Out of that, 18 patients were having normal delivery, and in control group, 12 patients were having section delivery. In experimental group, the 26 patients were having vaginal delivery, and only 4 patients was posted for section delivery. So this is the percentage we can see here. 60% patients were delivered vaginally, and in experimental group where the Shatahvadi Basti was given, 87 patients were 87% patients were posted for vaginal delivery. This graph presents route of delivery, that is in control group 18 patients vaginal delivery, 12 patients lower segment cesarean section, 26 patients in the experimental group where the Basti was given were delivered vaginally, and only 4 patients were posted for LSCS. So here we can see the difference between the route of delivery with administration of Basti and without administration of Basti. In the statistical analysis, the pair T test and Z test were applied that concluded the treatment does have effect towards the vaginal delivery. In discussion, the Garbhasanga and Prakruti, more number of patients with Prakruti as Vata Pradhan Prakruti were prone towards Garbhasanga and age. In our study, out of 60 patients, 51 patients were below 24 years because the study was conducted in lower socioeconomic. But nowadays, we can say that the parity and the number of patients, age of the patients is increasing day by day. So this is the condition where Shatahvadi Basi will play an important role for vaginal delivery. Garbhasanga and parity. The grand multiparity includes the prolonged labor by it is stated by modern science because of the laxity of muscles, pendulous abdomen, and the lumbar lordosis. These are the effects of on the Garbhashay and Garbhasanga occurs. The Garbhasanga Hetu, the mainly Hetu found are Vataprakopak Ahar, Vataprakopak Vihar, Vega Vidharan, Arsha, Pandu. The patients were also having Arsha, patients were also having Pandu, patients were having Abhishandi Ahar, that is stale meal and all these things. Dhatu shaithilya, atichinta. Some patients were having leaking, some patients were having post-datism, some were grand multipara and cord around neck. These were the hetus found for Garbhasanga. Garbhasanga and Srotodushti, when we consider the Srotodushti, 40 patients were having Purishiva Srotodushti. Uh, One thing I want to mention over here that the Pachan of Raja, Pachan of Garbhashaya, Pachan of placenta, nowadays we can say, and that occurs, that is the maturation of placenta occurs because of the Samana and the Agni at the area of the Nabhi. So if the Purishava Srotas is Dushta, then it impacts the delivery process. Also in Dhaneshwari also it is stated that Pasuna Vishteja Dathari Ukudoni Navamasantari Garbhini Jese. This means that the maturity of placenta and Purishava Srotas Dushti, these two are having coordination with each other. Also, if the Purishava Srotas is Dushta, then it vitiates the Vat, and because of that, the Garbha Nirasamana, that is descent of the head, is blocked, and because of that, the Garbhasanga occurs. Basti and contraction. The number of contractions per 10 minutes, that was also noted on the partograph. The experimental group, the 22 patients, were having duration of contraction less than 20 seconds before Basti, and after introduction of the Basti, those number of contraction and the amplitude was increased by 40 to 45 seconds. That was 20 seconds earlier, and that was increased to 40 to 45 seconds. That means that after introduction of Basti, the contractions were lasting for 40 to 45 seconds, that is more than the 20 seconds. One more thing, the amplitude of contractions were in 22 patients it was mild, that was increased as strong contractions in 30 patients, and 7 patients were showing moderate contraction after introduction of the Basti. This is the part of the partograph I have drawn over here. Number of contractions per 10 minutes. Only one contraction was having. This is one of the example of the partograph. I am having all 60 partograph in my thesis, and this is the one partograph I have plotted over here. Only one contraction per 10 minutes. After say 5 hours also, that was only one contraction per 10 minutes. Then this is the sign, the arrow indicates the Basti. The Basti was introduced to the patient, and after that number of contractions increased to 2 in 10 minutes. After that it increased to 3 and then 5. This is the number of contractions increasing with the help of the Basti. Also, the dilatation of cervix was plotted on the graph of the partograph. The 4 patients having 1 centimeter dilatation, 21 patients were having active phase. The 19 patients responded very good and delivered by vaginal route. 5 patients were having full dilatation at that moment of time. Even the head is not getting descended properly. The Basti was introduced, and all the patients with full dilatation got delivered vaginally. Statistically, this proves that the rate of cervical dilatation due to the Basti is satisfactory and also clinically noted. These are the some of the examples or the some of the graphs I have plotted to show the response of the cervical dilatation to the Basti. This is the first point. Okay. This is the first point where the graph was plotted at 6 hours. Patient was telling कि 6 hours से pain है, so that was the plotted over here. So dilatation was 3 centimeter. After some hours, yani at the 10th hour, it was noted it was going properly. That was 5 centimeter dilatation. After 2 hours, then PV was done. Then it was the same as 5 centimeter at 12th hour. So here the arrow indicates that the Basti was given at this moment of time. After introduction of the Basti, the again 3 hourly the PV was done, and that was 1 centimeter more dilatation, that is 6 centimeter dilatation. and after that the progress was good and the patient delivered here normally vaginally. This is one more graph which crossed the action line also. The patient was in the clinic with 3 centimeter dilatation. She was saying 8 hours ho gaye hai. So that was the first point plotted over here. After 3 hours, we checked again and PV, and that was 4 centimeter only dilatation. So that was crossing the alert line. Sometimes it happens because patient is telling कि हाँ 3 hours 8 hours हो गया है. So we waited for some more 2 hours and again the PV was done. But this graph showed that the patient crossed the action line also. So this is a 5 centimeter only dilatation at the 15th hour of the progress of the labor. So here the Basti was given to the patient, and that was a very good response for the Basti, and the dilatation was 6 to 7 centimeters, 7 to 8 centimeters at 18th hour, and patient delivered at 19th hour. This is the graph plotted, and action line and alert line. The importance of action line, alert line are when the patient crosses alert line, that means the doctor should take some action for the patient for the delivery. And if the action line is crossed, then that is the alarming position and that has to be treated by the doctor. So action line को आपको भूलना नहीं है, ये बात हमेशा ही ध्यान में रखना है. So Shatahvadi Basti and descent of the head per abdominally by the rule of 5. The position of the head was normally how we check the whole 5 finger we can feel the head of the patient above pubic symphysis. This is the 5 by 5. Only 4 fingers are palpable for the head of the fetus, that is 4 by 5. This is the 3 by 5, and the whole head is not palpated, that is 0 by 5. This is the rule of 5. Okay, that indicates the descent of the head, that is crawling and all these things are happening in the patient. We can check per abdominally this descent of the fetal head. Per abdominally, the 5 patients were having 1 by 5, that is this thing. 11 patients were having 2 by 5, this thing. The 8 patients were having 3 by 5, this thing, and 5 patients were having 4 by 5. Only 1 patient was having 5 by 5, that is the head is just touching the brim. This was the finding before Basti. When we give the Basti, all the 5 patients having 1 by 5 show good response and delivered naturally. 2 by 5 patients also delivered naturally, and the 5 patients having 4 by 5 descent. Only 1 patient was posted for lower segment caesarean section. This is a descent of the head. I have shown the graphs by plotting it. So this was the descent of the head, and when the patient got admitted, that is 4 by 5. So 4 is the descent of the head of the fetus. Then again 3 early it was checked, that was the same, that is 4 by 5, and after 2 hours it was just 3.5. So here the Basti was given because the head is not getting descended properly, and after 3 hours we can check that only 1 by 5, only 1 finger was palpable per abdominally, and patient got delivered at 21st hour. The one more graph, for example, I have given over here. The patient was 3 by 5, and 3 finger was palpable abdominally. The fetal head was palpable. After 3 hours, the same thing was there. So Basti was given, and the patient, the descent of the progress of the patient of the fetal head was good, and patient delivered normally. This was the thing. This was the observed that Shatahvadi Basti is having good impact on the descent of the head. Shatahvadi Basti and Prasava Swarup, out of 30 patients, 26 delivered naturally and only 4 patients were posted for lower segment caesarean section. 26 patients deliveries, there were 24 patients without any undesired impact. The patients were mainly having Vatavardhak Vatapradhan Prakriti and Hetu Sinar Vataprakopak Ahar Vega Vidharan and Kleda. Shatahvadi Basti and Prasava Swarup. Few things were observed when Basti was introduced to the patients. The romancha, adhovata nisaran was there. Some patients were having a little bit giddiness because all the ingredients in the Shatahvadi tail are tikshna. uh, Secondly, then adhovata nisaran happened. Then some of the oil was expelled out because of the pressure of the fetus, and after that the mala pravritti and then prasava takes place. Like generally fecal material comes out first, and after that the prasava takes place, that is the fetus come out of the vagina. These were the observations during the labor. The Shatahvadi Basti and Prasava Swarup, some of the patients I have stated that they were having Brahma, and because why this Swedadik and Brahma? Because of the texture of the medications. Secondly, Shram, Garbhasanga is also there. So patient is having already labor pains for more than 10 to 12 hours. So because of that also Swedadik is there, and drugs of the Shatahvadi Basti are Ushnaviri and Tikshna. So because of that also the Svedadikya in the patients were observed. The patient having Shatahvadi Basti, and what was the neonatal outcome? That was the important thing. Out of 30 babies, 29 babies were having healthy cry and good Apgar score, that is above 7. Only one patient was having Apgar score 6 at minute 1, but it was raised to 8 at minute 5. And so that baby also did not require any critical care like in ICU. So this Basti shows very good neonatal outcome, we can say is as. If we talk Basti and Sutika on Mala Pravritti, generally when the Vata is Vikrut, that is Vata is vitiated, then there is Mala Sanga in the patients after delivery. Because of the Anulomatva, because of the Snehan of the Pakvasha and Shodhan and Bhedan nature of the Shatahvadi Basti oil, the Mala Pravritti occurred earlier and easier in the patients having Shatahvadi Taila Basti. Stanya Pravartan, that was observed that the patients were having early Stanya Pravartan, that is second or third day. Most of the patients were having Stanya Pravartan. That happens because of the Prakrut Gati of Vata dosha, and because of that the Raja Urdhvagamita is also Prakrut, and the Stanya Pravartan occurred at normal day. The effect of Shatahvadi Basti on postpartum hemorrhage, no PPH was found during this study. Involution of uterus, involution was very good, and patients were having good tone of the uterus after giving the Shatahvadi Basti. Mutra Pravritti, there was no any complaint regarding this Mutra Pravritti. Overall results, out of 30 patients in the control group, 18 delivered vaginally, experimental group 26 delivered vaginally. Out of 30 patients in the control group, 11 patients posted delivered 11 patients delivered vaginally without any undesired effect. In experimental group, the 24 patients delivered vaginally without any undesired effect. Basti has good effect on contraction, dilatation of contractions and dilatation of cervix. Statistically, it is proved that the drug has 99% confidence limit, no hazard, no hazard to garbha and garbhini seen with Shatahvadi Basti. The Basti has favorable effect of Mala Pravritti and Stanya Pravartan. Also, there is no PPH. The that states that the Shatahvadi Basti is having very good impact in the Prasav Prakriya. Uh, Nowadays also, even in OPDs also, we can introduce this Shatahvadi Basti with little bit change, that is Sasneha Niruha, that is Yukta Rath type Basti we can give Shukranila Vibandeshu plus Shatahvadi. Like this Sasneha Niruha Basti we are giving to the patients which are in which the 37 weeks of the pregnancy is completed, and after the 7 Bastis, generally the patient land in the Prakrut Prasav. So this is the changes, or these are the changes. Still we are giving the Bastis in our OPDs also. Also some studies, research works is going on the fibroid and the impact of Shatahvadi Basti on the patients with fibroids and all these things. So this is all for the effect of Shatahvadi Basti in Garbhasanga. So thank you so much to giving me this opportunity to present my views over here. Thank you, Dr. Asavari. Yeah.
Thank you so much for such a wonderful, very detailed explanation. Wonderful presentation.
Thanks. Thank you so much.
Yeah, you have done a great research work, and it was, very structured. So not only related to the effect on the prasav, but also afterwards. So, like checking out regarding the stanya pravartan, mala pravrutti, also looking at the garbha and the effect on the garbha after that. So it was absolutely awesome. Very nice. Thank you so much.
Thank you so much.
So let me see if anybody has questions here. There are no questions in the chat box, but I would like to open it up for everyone. So welcome everyone. I would love to have any questions. Are there any questions for Dr. Gouri? Okay. It was actually very clear, and I love the graphs also. Yeah, it was a very clear, nice presentation. Thank you so much. Okay. So thank you for attending our webinar. Please watch and subscribe to our CAR YouTube channel. Okay, I have one question here before we conclude. Okay, so the question is about ingredients of Shatahvadi Basti.
Okay.
And I'm sure that you talked about this, but if you can talk.
Actually, I stated about this thing. There is one reference in Ashtanga Hruday Sharir Sthan, that is Shatava Sarshapa Jaji Shigru Tikshnaka Chitrakaihi Sahingu Kushta Madanaihi Mutre Kshirecha Sarshapam. This tail has to be prepared in sarshapa tail, that is mustard oil, and total 9 ingredients like Shatava, Sarshapa, Ajaji, Shigru, that is Moringa, Tikshnaka, that is Marich, Piper nigrum, Hingu, Kushta, and Madan. These are the contents of the Shatahvadi tail. Okay.
Thank you. All right. So, Basti Matra. It was 240. Okay.
पहिलम सिद्धम हितम पायो योन्याम्याप अनुवासनम ऐसे कहा गया है. So this is the thing that anuvasan basti should be given in the patients with having Garbhasanga. So matra of anuvasan is 240. So 240 cc basti was given to the patients having Garbhasanga. But nowadays in our practice at OPD levels, we can give the basti like 80 cc matra basti praman, 60 ml oil, yeah, plus one more reference is there. Shukranila Vibandheshu Basti, that is in the Basti Kalpasthan Ashtanga Hruday. So Sneha Nirva Basti can also be given to the patients having nearby EDD or completed the 37 week of the pregnancy. This was the in this study 240 cc was given because the patient is admitted, all the things were controlled. But 240 cc anuvasan is little bit more at OPD levels. So you can give the Sasneha Niruva also when the patient completes the 37 week pregnancy. After that you can introduce this Basti.
All right. So thank you everyone for attending our webinar. Please watch and subscribe our CAR Council for Ayurveda Research YouTube channel to view our earlier webinars and also other presentations. We conduct these webinars every month, and there are really wonderful presenters as well as different topics. So please like, comment, and share the videos. Once again, I invite you to become our member. So if anybody is interested into becoming a member, we would love to talk to you. And also fill out our volunteer form. You can now also subscribe to our IU Update newsletter. So there is a newsletter that goes from CAR, which has a very valuable information to stay tuned to our projects and events. If you have any questions, feel free to contact us at ayurvedaresearchusa@gmail.com, or you can also reach out to me, asavari@mnayurveda.com. Thank you so much, everybody. Thank you so much, Dr. Gouri.
Thank you so much, Dr. Asavari, to giving me this opportunity.